following segment is sponsored by Revere Health. When it comes to medical care, it can be quite expensive, but there are areas where healthcare costs can be saved without compromising the quality of care. And Dr. Christine Foster is here with Revere Health to tell us about how you can achieve significant savings. Hello, doctor. How you doing?
Hey, great. How are you?
Fantastic. So excited to talk to you. This is an industry that we've all dealt with, and I certainly have. So why is it important, do you think, to have primary care physician?
Well, I think one of the most important things we can do in our lives is to get early care and routine care. Yeah. And that's best accomplished by establishing a relationship with a PCP. It's been said that in the United States we have a disease management system rather than a healthcare system. And part of the reason for that is that we delay care. So things can be brewing in the background of life. We're busy, we're working, we're raising family and kids, and there can be a problem. So a common example...
Don't skip out on those annual visits is what you're saying.
Exactly. Yeah. Well, a common example is a 30-year-old will have high blood pressure that's not diagnosed. It goes on and on for years, and all of a sudden, boom, they've got a heart problem or a kidney problem. So the way to pick up on that is that annual visit. Yeah. And the good news is those preventative visits are typically 100% covered.
That is huge right there, what you're just saying. I'm sure our audience is definitely interested in that. And there's two services, different costs and things. How does that break down that you're talking about? What your message is?
Well, I think preventative services, if you have any health plan and a high out of deductible, those expenses are covered for by your plan. But even if you don't have insurance, there are multiple ways to get free services for those things like eye exams, that wellness visit, cancer screening. So super important. I think one of the more hidden factors in healthcare is the right place. Okay. And that's where we spend even more out-of-pocket dollars, and so it makes sense because we're consuming healthcare that we shop around and compare prices.
And speaking of prices and out-of-pocket, emergency room visits, those are insanely expensive.
Yes, they are, absolutely. So a great point. Urgent care is I need to be seen, something's happened. So if you look here, you'll see that an emergency room visit on average is $2,259. Yeah. To be seen in an urgent care is about $176, and if you're seen by your PCP, it's about $90. So emergency rooms are for life-threatening emergencies, a heart attack, a major injury. Okay. But many times you can be seen by your primary care physician or an urgent care for less.
A lot of things don't require emergency room visits.
Correct. Yeah. Things like I've got burning when I urinate, I've got a fever, I've got a cough, I've sprained my ankle, or I've got a cut on my finger. Yeah.
Gotcha. Excellent. Well, Revere Health is where you can go to get a lot of that information. Where else? We got reverehealth.com. And they can call you. You're the chief medical officer there. You've been there a while. You've seen it all. You've done it all. Yes. What other advice do you have for our audience?
I would say don't forget shoppable services. So when you need things that you can plan in advance, make sure that you're price comparing. Sometimes we don't know we can. So I'll give you a personal example. I went to get an MRI the other day. I took the prescription, and the cost difference was between $300 and $1,500.
That's crazy.
It is.
That's massive. Having done the MRIs myself with multiple sclerosis, it adds up fast, for sure. So where can we go for more information on Revere Health?
I think we have a website. Our urgent cares are open 8 to 8. We provide a broad range of services, labs, imaging. So we are available, but a simple phone call, website, our app is great.
Awesome. Well, the doctor's in the house. Dr. Foster, thank you so much for joining us today. We appreciate it.
Thank you.